I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. When people complain about anxiety or pain, doctors often recommend medications. What about hypnotherapy? This is the People's Pharmacy with Terry and Joe Graydon.
Our guest is one of the country's most respected hypnotherapists. He's a medical doctor and psychiatrist who helps patients dealing with cancer, pain, and sleep problems.
Why doesn't mainstream medicine take advantage of this powerful tool? Compared to medications, hypnotherapy is safer and surprisingly effective.
Beyond helping people cope with difficult symptoms, hypnosis can also assist in overcoming unwanted habits.
Coming up on the People's Pharmacy, how hypnotherapy helps people heal from stress, pain, and trauma.
In the People's Pharmacy Health Headlines, your morning cup of Joe might benefit your brain in unexpected ways. Not only does it help you wake up, drinking unsweetened, caffeinated coffee day after day can lower the risk for Parkinson's disease and dementia, including Alzheimer's disease. Researchers analyzed data from nearly 205,000 participants in the UK Biobank. They classified the volunteers on the basis of non-coffee drinkers, those consuming 1 cup a day or less, those drinking 1 to 2 cups, 2 to 3 cups, and those consuming 3 or more cups daily. Over about 9 years, some of these people developed neurodegenerative diseases. Compared to those not consuming coffee, those who drank the most unsweetened caffeinated coffee had a 25% lower likelihood of being diagnosed with Alzheimer's disease, a 29% lower risk of Parkinson's disease, and a 33% lower chance of dying from either of these conditions. No benefits were associated with drinking sugar-sweetened or artificially sweetened coffee. The study did not address the presence or absence of milk or creamer.
This past summer, the Food and Drug Administration approved a new drug to treat people with Alzheimer's disease. The generic name is donanemab. This is being sold under the brand name Kisunla. Once a month, people with mild dementia or early Alzheimer's disease need to go to a clinic for an infusion. The estimated cost is around $32,000 a year, but that does not include the doctors and facilities fees or the pricey brain scans to detect microbleeding. British regulators have been less enthusiastic than their American colleagues. The National Institute for Health and Care Excellence, which determines cost-effectiveness in the UK, has stated that donanemab cannot currently be considered good value for the taxpayer. That's because these experts concluded the drug offers relatively little benefit and costs are too high. This determination should not have come as a big surprise. That's because another anti-amyloid Alzheimer's drug called lecanemab, sold under the brand name Leqembi, also failed to get approval from the National Institute for Healthcare and Excellence. Both drugs were approved for sale by the UK's equivalent of the FDA, so British subjects could, in theory, access the drugs if they're willing to pay out of pocket.
The best quality face masks, called N95s, have traditionally been used by healthcare workers during a single shift. They filter out 95% or more of viral particles and have been shown to reduce respiratory viral infections among clinicians. Early in the pandemic, N95 face masks were in short supply. Some nurses and healthcare workers had to reuse their face masks multiple times. How much did this reduce efficacy? A new study in JAMA Network Open was conducted at 6 emergency departments in the U.S. during the middle of the pandemic. 365 physicians, nurses, and nurse practitioners participated. The more shifts that these healthcare workers use their N95 masks, the less efficiently the devices filtered out particles. After 3 shifts, almost 1/3 of the respirators did not achieve the goal of 95% viral particle filtration.
Most people who catch COVID-19 recover within a few weeks. Up to 10% develop lingering symptoms that may last for months or even years. These long COVID patients have had little help for symptoms such as chronic fatigue, brain fog, trouble sleeping, shortness of breath, and pain. Canadian researchers have found disruptions in the balance of immune cells in the blood of such patients. In addition, people with long COVID have higher serum levels of two inflammatory proteins. One is called galectin-9, and the other is artemin. These proteins promote inflammation and may result from increased intestinal permeability or leaky gut. The scientists suggest that treating this condition might help reduce symptoms of long COVID. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. When you hear the word hypnosis, what comes to mind? Some people imagine a stage performance where a hypnotist gets a person to do something silly.
But hypnotherapy can be an extremely valuable tool for dealing with everything from stress and trauma to bad habits or pain.
Has a healthcare professional ever recommended hypnotherapy for you? Is it especially appropriate for certain conditions? Today, we'll talk to one of the country's foremost experts on the therapeutic uses of hypnosis.
Our guest today is Dr. David Spiegel. He is Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences, Director of the Center on Stress and Health, and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine. Dr. Spiegel is the co-founder and chief scientific officer of Reverie, an interactive hypnosis app.
Welcome back to the People's Pharmacy, Dr. David Spiegel.
Thank you very much, Terry. I'm delighted to be here with you again.
Dr. Spiegel, we like to think of you as the People's Pharmacy hypnotherapist. You are one of the world's foremost authorities on hypnosis. And there are probably some of our listeners who did not hear our first interview, so could you please help us better understand what it is that you do? What is hypnosis? How do you use it in therapy?
Thank you, Joe. I'm happy to do that. Hypnosis is a naturally occurring state of highly focused attention. It's like the state that you get into when you get so caught up in a good movie that you forget you're watching the movie and you enter the imagined world. It's been called believed-in imagination. And it has three components. One is this intensity of focus, like looking through the telephoto lens of a camera. You do that by dissociating, by putting outside of conscious awareness things you'd ordinarily be in consciousness. So right now, Joe and Terry, you're hopefully already so entranced by what I'm saying that you're not aware of the sensations in your bodies touching the chairs I presume you're sitting in. If you are aware of that, we could just end the interview now. But typically, our brains are very good at focusing on things we want to pay attention to, and do that by putting outside of conscious awareness things that might distract you. The third thing about hypnosis is what we call cognitive flexibility. It's a capacity to change your perspective, to try out being different and see what it feels like. It used to be called suggestibility. People are afraid of, some awful stage show they saw of a hypnotist having a football coach dance like a ballerina. I don't like making fun of people in any circumstances. But the concept is actually sort of interesting. You can try out being different in hypnosis and see what it feels like, and that's a great opportunity for change.
Dr. Spiegel, I missed something. I heard you tell us there are three components to hypnosis, and that the first is intense focus.
That's correct.
And that the third is cognitive flexibility.
Right.
But I missed the second one.
Well, Terry, you dissociated the second one. The second one
Okay.
is putting outside of conscious awareness things that would ordinarily be in consciousness. You can do that by to facilitate focusing intently. You just put other things outside of awareness, dissociation.
Well, I get into trouble with that one, Dr. Spiegel, because sometimes I get so focused, whether I'm reading a book, whether I'm on the computer, and Terry says something to me, and I completely miss it. And she comes back to me, well, didn't you hear what I said? And the answer is, no, I didn't hear a word of what you said. I was too focused. I suspect that might happen to some other people on occasion, too.
I would imagine. And Terry, I got to take Joe's side on this one. He really didn't hear you. He was so focused. And I'm glad you guys are still getting along so well despite that. But it's a...
Well, we're out about 55 years together. And so, yes, we have adapted.
I got to tell you, that's illegal in California to be or married that long, but I'm glad you're doing it.
Okay. Well, luckily we don't live in California.
That's right.
So we don't have to worry about that.
That's right.
Now, Dr. Spiegel, when we spoke to you before, you talked about everyone can benefit from hypnosis as long as they are hypnotizable, and most people are hypnotizable. Can you tell us, what does that mean, hypnotizability, and how you evaluate it?
Sure, Terry. Hypnotizability is a very stable trait. It's a capacity to do the things we talked about: focus intently, dissociate, and be cognitively flexible. It starts early in life. Most 8-year-olds are in trances most of the time. As you know, if you call your kid in for dinner and they're so busy playing, they don't hear you. They just like Joe, they really didn't hear you. But what happens as we go through adolescence and we develop what are called formal operations, that is, we value reason more and primary experience less, some people lose some of that ability to just lose themselves in play or other activities. And by the time you're 21, you settle into one of three styles of hypnotizability. The most hypnotizable people we call the poets. They just get so caught up in a good movie, they forget they're watching a movie. They focus intently. They're very imaginative and very intuitive in connecting with other people. We call them the poets. People in the middle range of hypnotizability, we call the diplomats. They engage in the experience, but then later they'll step back and say, what was that about? What was I thinking or feeling? And there's a minority of people we call the researchers, who just value reason over everything and just don't enter much of a hypnotic state. Now, anybody can benefit from techniques involving self-hypnosis, even if you're not hypnotizable, because it's the approach you take, focusing on what you're for rather than what you're against. If you want to stop smoking, you don't say don't smoke. That's like saying don't think about purple elephants. That's what you'll think about. You focus on what you're for, respecting and protecting your body. Anybody can benefit from that. But people who are moderately and highly hypnotizable can do it more easily because it's easier for them to lose themselves in the hypnotherapeutic suggestion.
Now, Dr. Spiegel, losing yourself. There are people who fear losing control. Oh, my goodness, I couldn't possibly participate in hypnosis or try it because I might lose control and do something I would regret. What's that all about?
Well, there's a sort of a good side and a bad side to the idea of losing yourself. Sure, you don't want to lose control, and people, even in hypnosis, can be very much aware of what's going on and not do things they really don't want to do. And one classic example is that the brilliant French neurologist Jean-Martin Charcot, who taught Freud how to use hypnosis, was doing a demonstration in which they had a young woman in front of a class of medical students. And he had her imagine that she was, murdering her mother, and she was shrieking and, making all kinds of noises and acted this out. And he swept out of the auditorium saying, see, you can make anyone do anything. The medical students had another idea. They suggested to her that it was time for her to go to bed and take her clothes off. And she yelled something obscene at them and walked out of the room. So she understood the difference between acting out a fantasy and acting out their fantasy, and she didn't do it. So people, even in hypnosis, can make a judgment of what they want to do and what they don't. They are aware. It's not like you turn the brain off. The rest of the brain is still processing information. But the good side of losing yourself, as you put it, Joe, is that sometimes our conception of ourself is actually stopping us from doing things we want or should do. I couldn't possibly control my eating. I couldn't possibly relieve my pain because I really hurt myself. And those are constraints that you can suspend in hypnosis and try out being different and see if you can do more than you thought you could.
Dr. Spiegel, we'd love to hear about your new research on a way to increase people's hypnotizability. Can you tell us about transcranial stimulation and what you did in the study?
Sure, Terry. This is with my colleague, Afik Fairman and Nolan Williams. Nolan is a world's authority on transcranial magnetic stimulation, which is a very exciting new technique that's being used to help people with depression, people who are feeling suicidal, people with obsessive compulsive disorder. It seems to be very helpful. And what it does is you apply a magnet to the surface of the head in a specific region that can either stimulate or inhibit specific regions of the brain. And we found that if you stimulate the dorsolateral prefrontal cortex and the upper left front part of the brain, you can actually enhance people's hypnotizability, because in earlier studies we showed that coordinated activity between that region and a deeper region called the dorsal anterior cingulate cortex. It's part of the salience network that's in the brain's alarm system. You can turn down activity there, inhibit it, and therefore enhance hypnotizability. And that's exactly what we found in the study, that the people who had real versus sham stimulation of that region wound up being more hypnotizable.
So, Dr. Spiegel, by enhancing hypnotizability with transcranial stimulation, what difference does it make in the therapeutic session?
It can help people concentrate more intently and respond more quickly. People can get help without it, and this is still an experimental procedure that doesn't last all that long, but it can enhance people's motivation and ability to help themselves with stress or pain or insomnia or other problems they're using hypnosis for.
You're listening to Dr. David Spiegel, Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences. He's also Director of the Center on Stress and Health and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine.
After the break, we'll find out how you might use hypnotherapy for healing from stress.
Have any studies compared hypnosis to medication for pain control?
Why wouldn't doctors everywhere offer patients hypnosis for painful procedures?
One might be able to use hypnotherapy not only for pain, but also for insomnia.
Hypnosis could also be used for veterans and others who have experienced trauma.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is made possible in part by CocoVia, backed by 20 years of scientific research and the maker of the most proven and concentrated flavanol extract in the market today, Coco Pro Cocoa Extract. Cocoa flavanols are among the most studied plant-based bioactives today and are clinically proven to promote cardiovascular and brain health for the long term, supporting a strong heart and better memory.
Get 15% off your order of any CocoVia product by using the discount code PPOD15. Learn more at CocoVia, and remember that discount code is PPOD15.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. CocoVia Memory Plus is formulated with 750 milligrams of cocoflavanols, a level clinically proven to improve 3 different types of memory and support brain function. More information at cocovia.com.
We're talking about how hypnotherapy can help people heal from stress, pain, and trauma.
Our guest is Dr. David Spiegel. He is Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences. He's also Director of the Center on Stress and Health and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine.
Dr. Spiegel, you just mentioned a few things for which people might consider hypnotherapy. Anxiety, stress, for example. We've heard about smoking. Why don't you run through for our listeners all of the things that you've tried as a hypnotherapist and physician, and some of your colleagues have done successfully utilizing hypnotherapy?
Sure, Joe. Hypnosis is a very helpful adjunct to treatments for problems like stress. We can help people manage their stress better. And the particularly cool thing about the use of hypnosis is you will know right away whether or not you're able to respond and reduce your stress. So on our digital interactive hypnosis app, Reverie, we ask people to rate their stress levels from 1 to 10. And we teach them to deal with the stress by imagining they're floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or floating in space. And picture on an imaginary screen the problem that they're dealing with on one side while controlling your physical reactivity to it. And on the other side of the screen, picture one way to resolve the problem, to address it. So you free your imagination to think about how you deal with the problem while at the same time keeping your body comfortable. And we find that 4 out of 5 people doing this report an immediate reduction in stress, an average of 1.5 points out of 10. So you know right away whether you're able to better manage stress psychologically, but also physiologically.
I'm curious about whether anyone has done a study comparing what you're describing, hypnosis for stress, versus, for example, a benzodiazepine like Valium or Librium or Xanax.
We've done studies like that with pain control, for example, which is certainly a stressor. We did a randomized trial published in The Lancet, 241 subjects undergoing an acutely very stressful procedure that involves an arterial cut down and threading catheters through the body to chemoembolize tumors in the liver or deal with renal artery stenosis. And there were 3 conditions. One was the pharmacologic one, push a button and you would get opioids. The second was that plus having a friendly nurse providing emotional comfort. And the third was that plus learning self-hypnosis. Imagine your body cool, tingling, and numb, filter the hurt out of the pain. And at the end of an hour and a half, it's about a 2.5-hour procedure, the patients in the standard care condition, their pain was 5 out of 10. Their anxiety was 6 out of 10. The patients who had the nurse helping them, both the pain and the anxiety were 3 out of 10. The hypnosis group, the pain was 1 out of 10, and they had no anxiety at all. I was afraid they were dead or something because they were just so relaxed. And you know what? The treatment team was more relaxed too. They actually got done 17 minutes quicker. So, and they were using half as much opioids. So they were able to do much better psychologically, have less stress and less pain using hypnosis, randomized clinical trial. And one of the things that troubles me, Joe, is that if I had published that trial using another drug like a benzodiazepine, every hospital in the world would be using it. But they don't because they have trouble believing that the brain can so powerfully modulate stress and pain.
Well, that's exactly what I wanted to ask you. This sounds like a no-brainer, actually. It sounds like doctors everywhere should be offering patients at least the option of using this hypnosis technique for painful procedures. Why don't they?
I wish I knew but it's a yes brainer, not a no brainer. Use your brain. It's a resource. The strain and pain lies mainly in the brain, and we can learn to modulate all kinds of physical discomforts, and people do. Why is it? There's this kind of prejudice against psychotherapy, against the power of the brain. That is, if you make the pain better using your brain, sometimes people assume, well, you're not really in pain. You're not having pain. That's not true. Your brain is helping you to modulate the pain. And I agree. I think it should be used everywhere. Many good pediatricians and dentists will use some kind of self-hypnotic or breathing exercise to help people be more comfortable. But sadly, it's the exception, not the rule. It doesn't cost anything. It has no side effects. And it makes people feel good. They surprise themselves that they can actually do so well in controlling their stress and pain. I wish I knew. I've been working my entire career, 50 years, Joe and Terry, and that's why I built Reverie, because I wanted to make it available to anybody who wanted to use it to learn how to control stress and pain in any circumstance.
Dr. David Spiegel, I would like to make you the head of the National Institutes of Health, the National Science Foundation, and all of the charitable funding organizations out there give you the ultimate financial and emotional power that you need in order to encourage your colleagues in the healing professions to consider hypnosis as a viable, beneficial therapeutic modality. How would you go about doing that if I bestowed on you all that power and money?
Bless you, Joe. Well, I'd start out by hypnotizing them. I like to teach people how much you can change the way you feel just using your brain better. And so I think, just as we've had these huge programs of exercise and fitness to get your body in better shape, which is a wonderful thing, I do it too, we should do the same thing for using our brains to help better manage our body and live better. So I would set up problems where teaching people to manage stress, pain, insomnia would be the first thing we do, not the last. That before we reach for medications, we would teach people how to better manage themselves, and it would be a necessary part of every medical intervention because it can help with just about any medical problem, as well as, of course, psychological problem.
It astonishes me that people who have surgery these days, maybe a knee replacement or some other pretty significant surgical procedure, are often reluctant to take opioids. They go, well, I've heard so much bad about opioids. I don't want to get addicted. And a lot of physicians are very fearful about prescribing opioids. So they come up with gabapentin or some other combination. And, oftentimes people are still in pain, especially when it comes to nighttime. So here they are in pain, and they're having a hard time getting a decent night's sleep, which is what they need in order to heal from the surgery. So tell us a little bit about hypnosis, not just for the pain, but also helping people get to sleep, because there are a lot of people who suffer insomnia who are not in pain.
You're absolutely right, Joe. And the people who are afraid of opioids ought to be afraid of opioids. They're okay for acute pain for a couple of days, but if you continue after surgery, for example, to take opioids, every day you take more opioids, you're more likely to get addicted. And it's very dangerous because when you stop the opioids, you get what's called withdrawal hyperalgesia. The pain is actually amplified by reducing the opioids. So opioids are fine for acute pain for a couple of days, but otherwise they're dangerous. We lost 88,000 Americans to opioid overdoses last year in the United States. It's very dangerous. On the contrary, hypnosis can help you, and you're absolutely right that sleep is a particularly vulnerable time because the pain can wake you out of sleep, and then you're suddenly reminding yourself of the effects of the surgery and how much discomfort you're in. To sleep, you need to turn off the sympathetic nervous system, the fight and flight system. You'll notice when your alarm goes off in the morning, you're sort of awake with a jolt and your heart rate goes up. it's because when the sympathetic nervous system is operating at full tilt, you can't sleep. What you need to do is induce the parasympathetic, the rest and digest system. That's what dominates our autonomic system in sleep. And so what hypnosis can help you do is deal with the sympathetic arousal. You imagine you're floating somewhere safe and comfortable, a bath, a lake, a hot tub, or floating in space. Start with your body and work your way up. So don't worry about solving the mental problem. Just picture your body being somewhere safe and comfortable. And then if you're still having some preoccupation or you're worried about the pain you're feeling, picture it on an imaginary screen as if you were watching a movie outside of your own body. So you dissociate the mental stress from the physical stress, and you allow the parasympathetic nervous system to take over and get you back to sleep.
Dr. Spiegel, can you use hypnosis to help people who have experienced trauma?
Yes, Terry. I've used it for that purpose quite a bit. And it can be extremely helpful because, unfortunately, trauma leaves people often with a view of themselves that is damaged and disturbing. They also, when they think about it, they kind of relive the sense of threat. So you get this sort of physiological arousal. The memory kind of reattacks you again. It me-attacks you too. And you feel vulnerable. And one of the other serious things that happens to people who have suffered trauma of one kind or another is they blame themselves for events they didn't control. And this is especially true for children when they're mistreated or abused, that the first thing a kid will say when something goes wrong is, it's not fair, because they think the world is fair. And if something has happened that's bad and the world is fair, then maybe somehow I did something to deserve it. And so they feel inappropriately responsible for something they didn't control. What hypnosis can help you do is restructure your memory of and understanding of what happened during trauma. And so I had a patient recently who unfortunately suffered mistreatment from her father, and yet she finds herself as an adult, a very successful adult in many ways, still having very close contact with her parents, living near them, feeling she can't, separate herself, and that she's afraid to be away from them. And I had her picture herself as a little girl when one of these episodes was happening in hypnosis. And I said, I want you to answer one question. Is this her fault? Pretend you're your own mother. And what would you say to yourself? And she started to cry and she said, I'm stroking her hair. I'm stroking her hair. And she said, no, this isn't her fault. And she came out of it feeling different about the abuse and her current relationship with her father, that she didn't owe him much at this point, and she didn't have to feel that she had to look after him or that she needed to be afraid of not looking after him, not being with him. So it can help people, because of the cognitive flexibility, to see it as if you were a somewhat different person who could better understand as an adult what you obviously couldn't understand as a child. So hypnosis can be very helpful in managing physiologically your understandable reactions to traumatic memories, but also restructuring your understanding of the trauma itself.
Dr. Spiegel, I wonder if you could tell us a little bit about some of the veterans and perhaps other patients you've treated
Yes.
with regard to trauma, because veterans oftentimes carry a lot of invisible wounds that are hard to heal.
They do. They do. About 1 out of 4 men and women who experience combat develop post-traumatic stress disorder. I remember seeing just a lovely man who was a cook in Vietnam, actually, and he'd been in the military for 16 years. He was a lifetime Army guy. And suddenly he just went haywire in Vietnam around the time of the Tet Offensive and went off into the jungle screaming and shooting at people. And he eventually got taken out of active duty, and he wound up getting put in a state mental hospital for a year. This was a guy who'd had a perfectly normal, honorable service record, and suddenly he couldn't function. And we went back and relived it in hypnosis. I said, what happened? And he starts reliving a scene where he had adopted a Vietnamese orphan who had been badly burned, walked with a crutch, and he himself was the youngest of 16 children, and he sort of informally adopted this little boy, and just loved him. They loved one another. And he comes back one day in the Tet Offensive and sees the boy has been killed in the offensive. And he relives it. He starts crying, "I should have taken you over to the hooch. You wouldn't be there, man. It's all my fault. It's all my fault." And I had him relive the time when he buried the boy. He said he was shaking his fingers in front of his face and saying, "Ashes to ashes and dust to dust, I guess." And then I said, "I want you to remember one time when you were really happy with him." And immediately a smile comes over his face, and he remembers a birthday party that he held for the boy. And he says, "Yeah, I had my sister send you an electric train. You ain't never seen an electric train before." He said, he's so happy, and his mood changed immediately. And I had him picture those two scenes. One, to remember that he lost the boy. It was tragic. And he said, he knew he was going to die. He was crippled. He looked like he had arthritis. He didn't think he was going to survive. But I said, I want you to remember the happy times you had with him, because that's true too. And that can provide you with comfort. It hurts so much because you were so happy together. And he came out of this whole hypnotic experience, and I asked him what he remembered from it. And he said, "That's funny. I remember a grave and a cake." And he started to do his grieving for the boy's loss and came back to himself. And he wound up getting out of the hospital. He practiced self-hypnosis, and he spent his time after that teaching teenage kids how to do long-distance cycling. So it can be a turning point for people in dealing with traumatic memories.
When you're dealing with someone who has a serious situation like that, how many sessions does it usually take?
Well, they often feel a turning point right away. He was still in the hospital at the time, and I saw him, probably 10 times after that to help consolidate what he did. But it can be sometimes surprisingly fast that people get a new point of view about an old painful problem and start to heal once you help them do that turning point. And I teach them to practice self-hypnosis. So he would sit in the hospital ward doing that exercise and picturing the grave and the cake and on a daily basis. So the nice thing about hypnosis is you can use it in therapy, but people can use it on their own as well.
You're listening to Dr. David Spiegel. He is Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences. He's also Director of the Center on Stress and Health and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine. Dr. Spiegel is the co-founder and Chief Scientific Officer of Reverie, REVERI, an interactive hypnosis app.
After the break, we'll find out how Dr. Spiegel's app, Reverie, works.
We'll get a quick demo of what hypnotherapy is like.
How does hypnosis for healing from stress fit into the actual recovery process?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you in part by The People's Pharmacy Urea Skin Relief.
When temperatures drop, the heat comes on.
Unfortunately, that means lower humidity and drier skin.
How can you keep your skin comfortable and healthy this fall and winter?
Well, we are pleased to announce the People's Pharmacy Urea Skin Relief. It has 20% urea, which improves the skin barrier function and helps with deep moisturizing.
This intensive skin therapy is available in either handy 2-ounce or economical 6-ounce tubes, but it's only available on the peoplespharmacy.com website.
As a People's Pharmacy podcast listener, you can get 20% off your purchase of Urea Skin Relief from now through the end of the year.
Just enter SKIN20 as your discount code when you check out from the store at peoplespharmacy.com. Remember, SKIN, SKIN 20 for your discount.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. CocoVia Cardio Health is offered in both convenient capsule and powder formats, with each serving containing 500 milligrams of cocoflavanols to support heart health. More information at cocovia.com.
Hypnosis has been available as a therapeutic tool for more than 200 years, but modern medicine doesn't seem to have embraced this healing modality with much enthusiasm.
Our guest is a medical doctor and psychiatrist with decades of experience using hypnotherapy to help people heal from trauma and stress. Not everyone can find a certified hypnotherapist, though. Most psychiatrists and psychologists are not trained to practice hypnotherapy.
That's why Dr. Spiegel has developed an app called Reverie that you can use right on your phone or tablet. In his practice, he has also helped people deal with some challenging habits. In this segment, we'll be discussing how he's helped some patients who were worried about their use of pornography. Consequently, this content may not be appropriate for all listeners.
Dr. David Spiegel is Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences, Director of the Center on Stress and Health, and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine. Dr. Spiegel is the co-founder and Chief Scientific Officer of Reverie, an interactive hypnosis app.
Dr. Spiegel, I wonder if you can tell us about the app that you developed to make hypnosis accessible to lots of people. What is it, and how does it work?
Sure, Terry, I'm happy to do that. So Reverie, Reveri, is available on the web, reverie.com, or through the App Store or Google Play. And what I wanted to do was make available to anybody who wanted it or needed it to learn to use self-hypnosis to deal with problems like stress, pain, anxiety, insomnia, controlling eating, stopping smoking, because I use it for all of my patients, and I wanted it to be as available as possible. And I've used hypnosis with about 7,000 people in my career, but I'm glad to say that while we're talking now, we have many thousands using Reverie to help them learn to manage these problems for themselves and see how they feel within 10 minutes after starting to use it. So you get to hear my mellifluous voice anytime you want, and it's interactive. So I'll ask you, is your arm floating up in the air? Are you feeling light and comfortable? And if they say yes, we go on to something else. If they say no, they get a different instruction. So we tried to make it, Joe and Terry, as much like the experience of being in my office as we could. And we're finding that a whole lot of people are able to reduce their stress levels, control their pain, sleep better, and deal with a number of other problems. So it's self-hypnosis for anybody and everybody.
And that's a real blessing because, Dr. Spiegel, a lot of people don't have access to a well-trained, credentialed hypnotherapist such as yourself. You've been trained,
Yes.
classic medical school,
Yep.
psychiatrist.
Yep.
It's my understanding that you come from a family of hypnotherapy, that your dad was involved in this. So
Right.
you're just continuing this tradition, but many people don't have access to someone such as yourself, and being able to use an app on a phone or a computer can make life a lot more, shall we say, convenient and affordable. But
That's
let's find out what it feels like. And we're going to caution our listeners, if they're driving, turn off the radio right now.
Right.
And if they're doing any activity that requires immediate attention,
Right.
this may not be a time to listen to the People's Pharmacy. But can you just walk us through a little session to give us a flavor of
Sure.
what we might experience using the Reverie app, or if we were in your office, what it would be like to be hypnotized.
Sure, Joe. Glad to do it. So get as comfortable as you can. On one, do one thing, look up. Two, do two things slowly. Close your eyes and take a deep breath. And on three, do three things. Let the breath out, let your eyes relax, but keep them closed, and let your body float. And then let one hand or the other float up in the air like a balloon. And that'll be your signal to yourself that you're ready to concentrate. Just imagine you're floating in a bath, a lake, a hot tub, or floating in space. If you have any sense of discomfort in your body, imagine that that part of your body is cool, tingling, and numb, or soothed and warm, whatever actually helps your body feel better. But notice how quickly and easily you can help yourself and your body feel better. Picture in your mind's eye an imaginary screen. It could be a movie screen, a TV screen, or a piece of clear blue sky. And picture on it a pleasant scene, somewhere you enjoy being. So that your body is floating safe and comfortable, you're picturing a scene. And if something is worrying you, divide the screen in half and picture one thing that's troubling you on the left, but with the rule that whatever you see on the screen, you keep your body floating and comfortable. And then use the right side of the screen as your problem-solving screen. What's one thing you could do to deal with the problem on the left? So your body's floating, and you're able to visualize one thing that's troubling you and one way of dealing with it. Body floating safe and comfortable. Now take a few moments to reflect on what this means to you in a private sense. And now we'll come out of the state of self-hypnosis together by counting backwards from 3 to 1. On 3, get ready. 2, with your eyelids closed, roll up your eyes. 1, let your eyes open, your hand float back down, make a fist open, and that's the end of the exercise.
Thank you so much.
How lovely and how reassuring. Not scary, not doing anything you don't want to do, but just
That's
relaxing.
Right. That's right. You got it. That's it.
Dr. Spiegel, I would like to tiptoe, literally, figuratively, into a very controversial area. I have read that as a result of COVID, when people were all cooped up, that there was an increase in pornography use, and that has continued. And there are a lot of people who are very uncomfortable with that concept, even people who are engaging in pornography for perhaps minutes or hours a day. I understand that you have been working on a lot of areas, including the quit any habit.
Right.
And obviously, there is a lot of stigma associated with the use of pornography. Help us understand what the problem is and how hypnosis can be helpful.
Well, it's a problem in which pornography involves, demeaning people. And there's a sense in which you're using it, you're participating in that process. It's also, to some extent, debasing the best things about human sexuality, which are pleasure and connection. And you don't want to gradually condition yourself to a form of less rewarding and less ethically comfortable sexual engagement. So what one can do, as we would do with other habits that you want to change, is have you focus on what you're for, which is reinforcing your understanding of yourself and your use of your body and your connection with another person as something that creates real pleasure for both and builds connection. And so you can use self-hypnosis as a way of reminding yourself of what sexuality at its best can be about and what it has been in your life. And focus on, if you have an impulse to engage in sexual activity, to use self-hypnosis to review the best aspects of sexual pleasure in your life and enjoy them in your reliving of them rather than the worst aspects.
Can you perhaps give us a sense of how well hypnosis has worked for some of your subjects without, of course, revealing anything that might be personal?
Um, yes, we haven't done formal studies about that, but my impression is that people can find it to be a way of kind of reacquainting themselves with the best in their sexual lives and perhaps enhancing their sexual experiences, focusing more as they engage in real loving sexuality on both their own pleasure, but focusing on enhancing the pleasure of their partner, because that's one of the things that is demeaned in pornography. So prepare yourself to have more genuine sexual pleasure by thinking about in hypnosis how you make yourself feel good. You focus on the pleasure rather than the outcome, on prolonging the period of giving and receiving pleasure, and prepare yourself to make a more genuine and positive sexual experience available to yourself and your partner.
Dr. Spiegel, I have a question that's going to seem like a very odd follow on to this part of the conversation. And
Okay.
that is, as you are talking about how you could use hypnosis to overcome a habit that you're not happy with, I'm thinking it sounds as though you could use hypnosis, since what you have to focus on is what are you for, the positive aspects. You could use hypnosis to try to uh, reinforce what you see as your better self. And that itself has a kind of a spiritual aspect to it. Am I way off base?
Not at all, Terry. And there are hypnotic like experiences that people have. There are many religious practices that involve, like speaking in tongues and things like that, that have a hypnotic like quality to them. And I think you're exactly right that I think people use their intense imagination to engage emotionally, not just cognitively, in religious experiences or practices, in feeling good about yourself because you're adhering to goals that you respect and admire and have learned to make a part of your life and a goal in your life. So hypnosis can be used. I think many people find that when they're in deep religious prayer situations, that it is hypnotic-like, that they dissociate, that they find themselves, being a different and better person. And part of the cognitive flexibility in hypnosis is the capacity to let go of your usual assumptions about yourself and try out being different. And I think many people appropriately use religion to try out being different. And to the extent that you can live it and feel it and become engaged in it and suspend your usual self, oh, I can't do that, I can't be any better, to try out what it would feel like to be a different and better person. And I think religion often helps people to do that.
Dr. Spiegel, I'm curious about a very big picture question regarding healing, because the idea of using hypnosis for healing may seem a little odd to a lot of your colleagues who are surgeons or gastroenterologists or cardiologists. And yet I suspect that hypnosis for healing could be very helpful, especially, let's say, when somebody is undergoing cancer chemotherapy, which can be painful and scary, or even radiation therapy, but also a cardiac procedure, or even getting ready for surgery, and then post-surgical. So can you help us better understand how health practitioners could use healing hypnosis to deal with not just the stress, but the actual recovery process?
Well, it's, certainly I'm a physician and I run the Center for Integrative Medicine. So it's not one or the other. I am not at all in favor of people who just think healing in the mind is going to replace medicine, because it won't. However, there's no question that making a team of your mind and your body is the best way to deal with any serious medical problem. And so there's a long history of, type A personality, worsening cardiac disease. I've done research for decades helping women with metastatic breast cancer live better using group therapy and hypnosis. And we find in randomized trials that the women who come to weekly support groups have less stress over time. They handle their emotions better. They have half the pain on the same and low amounts of medication. And in several studies, the women randomized to group therapy actually lived longer than controls. It was no cure for cancer, but they actually did survive longer. And I think part of it is, are you in an alliance with your body and your doctor and your family in coping with the illness, or are you angry and struggling and critical of your body? I had one cancer patient say that my body was like a dog that stopped obeying me. It wouldn't do what I wanted it to do. Whereas if you can form an alliance with your body, think of your body as you would your child who was ill, and nurture and comfort it, you'll do better, and your body will do better too.
Dr. Spiegel, we have just about a minute left to the end of our interview. I would like to know, what is the message that all of our listeners should take home with them today?
Thank you, Terry. It's that the brain and body work best when they work together, that there's much you can do using your own mind with techniques like self-hypnosis to comfort yourself, to live better, to help your body live better and do better too. So take full advantage of the resource that your brain provides you to see an old problem from a new point of view, help your body be more comfortable, and to comfort it. And you'll feel better. You'll have less discomfort. You'll live better during the day, and you'll sleep better at night.
Dr. David Spiegel, thank you so much for talking with us on the People's Pharmacy today.
You're most welcome, Terry and Joe. Happy to be here.
You've been listening to Dr. David Spiegel. He's Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences, Director of the Center on Stress and Health, and Medical Director of the Center for Integrative Medicine at Stanford University School of Medicine. Dr. Spiegel is the co-founder and chief scientific officer of Reverie, an interactive hypnosis app. It's spelled Reveri. We have a link to it from our website.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
The People's Pharmacy is made possible in part by CocoVia dietary supplements, cocoflavanol supplements that support cognitive and cardiovascular health, made with a proven concentrated flavanol extract. More information at cocovia.com.
Today's show is number 1406. You can find it online at peoplespharmacy.com. That's where you can share your comments about today's interview. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider, including YouTube Music. You'll find the podcast on our website on Monday morning.
At peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast, so you can find out ahead of time what topics we'll be covering. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you so much for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.